1 in 3 children in Africa suffers from stunted growth and half of child deaths across the continent are linked to hunger, the African Children's Policy Forum said. According to a study by the Addis Ababa-based think tank calling for urgent action, almost 60 million children in Africa do not receive enough food despite the continent's rapid economic growth in recent years. Every 3 seconds, a child dies of hunger. According to a report in The Guardian, every 3 seconds a child dies from food insufficiency worldwide. While global data shows that child hunger is improving, in parts of Africa the situation is worsening due to political will. 9 out of 10 African children do not meet the minimum nutritional criteria set by the World Health Organization. Liberia, Congo, and Chad are at the bottom of the list in the graph of adequate and varied nutritional intakes at healthy intervals for children aged 6 to 23 months. They are followed by Zimbabwe, Guinea, Gambia, and the Democratic Republic of Congo. It will cost 17% of Africa's economy. Hunger, which negatively affects growth and cognitive development in children, also seriously affects the economic performance of countries. According to the report, child hunger can cost African countries 17% of their total economy. Liberia, Congo, and Chad are the 3 countries at the bottom of the list in the graph of adequate and varied food intake at healthy intervals for children aged 6 to 23 months. They are followed by Zimbabwe, Guinea-Bissau, Gambia, and the Democratic Republic of Congo. ACPF Executive Director Asefa Bequil emphasizes that child hunger is fundamentally a political problem, saying, "It is the result of a disastrous combination of political insensitivity, lack of accountability of governments and wrong economic policies. It is a persistent and naked reality, yet it remains a silent tragedy. This fundamental problem is widely unrecognized and tolerated. Probably because hunger is seen as a poor people's problem. Starving children to death in the 21st century is unacceptable." Stating that in the 21st century, it is unacceptable that children are still dying of hunger, Bequil continued, "The statistics are alarming. The main causes of child hunger are extreme poverty, unequal and non-inclusive economic growth, gender inequality, and a broken food system. Africa is producing more food today than ever before, but this has not improved nutritional conditions." UNICEF warns. Children facing alarming levels of drought in parts of Africa are just one disease away from disaster. In Ethiopia, Kenya, and Somalia, the number of people affected by drought and without reliable access to clean water has risen from 9.5 million to 16.2 million in 5 months, while children in the Sahel face extremely high levels of water scarcity. During World Water Week, UNICEF warns that children in the Horn of Africa and the Sahel face a serious risk of death if they do not receive urgent support for both severe acute malnutrition and waterborne diseases. UNICEF Director General Catherine Russell said, "History shows that when high levels of severe acute malnutrition are combined with outbreaks of deadly diseases such as cholera or diarrhea, child mortality increases dramatically and tragically. The risks to children increase exponentially when water is unavailable or unsafe. Millions of children in the Horn of Africa and the Sahel are just one disease away from disaster." In Burkina Faso, Chad, Mali, Niger, and Nigeria, drought, conflict, and insecurity are driving water insecurity, with 40 million children facing high and extremely high levels of water scarcity. More children are already dying from unsafe water and sanitation in the Sahel than anywhere else in the world. Most people in the Horn of Africa rely on water supplied by vendors from trucks or donkey-drawn carts. In the areas hardest hit by the drought, many families can no longer afford the cost of water. In both regions, more than 2.8 million children already suffer from severe acute malnutrition, meaning they are 11 times more likely to die from waterborne diseases than well-nourished children. In Somalia, outbreaks of acute watery diarrhea and cholera have been reported in almost all drought-affected areas, with 8,200 cases reported between January and June, more than double the number of cases reported in the same period last year. Almost 2/3 of those affected are children under the age of 5. UNICEF and partners treated more than 1.2 million cases of diarrhea in children under 5 in the most drought-affected regions of Ethiopia, Afar, Somalia, Southern Nations and Peoples Region, and Oromia. In Kenya, more than 90% of open water sources such as ponds and open wells in drought-affected areas are either depleted or drying up, posing a serious risk of epidemics. UNICEF is providing life-saving assistance and resilient multisectoral services to children and their families in urgent need in the Horn of Africa and Sahel. These services include improving access to climate-resilient water, sanitation, and hygiene services, drilling for reliable groundwater sources, developing solar energy systems, identifying and treating malnourished children, and scaling up prevention services. Russell continued, "Imagine having to choose between buying bread and water for a starving child who is already sick, or watching your child suffer from extreme thirst, or allowing them to drink contaminated water that can lead to deadly diseases." Families in drought-affected areas are being forced to make impossible choices. The only way to stop this crisis is for all of us, governments, donors, and the international community, to accelerate funding to meet children's most urgent needs and provide long-term flexible support to break the cycle of crisis. Tackling hunger requires a concerted effort between individuals, communities, and the international community. The following outlines some key steps and solutions to tackle hunger in Africa. Agriculture and production. Agriculture is a key livelihood sector for the majority of people living in Africa. Sustainable agricultural practices should be promoted, modern farming techniques should be taught, and agricultural infrastructure should be improved. At the same time, local farmers need to be supported to increase local production and ensure food security. Coping with climate change. Climate change in Africa is having negative impacts on agriculture, water resources, and food security. Therefore, policies and practices to tackle climate change should be developed, renewable energy sources should be promoted, and deforestation should be prevented. Humanitarian assistance and international cooperation. The support of the international community is vital in the fight against hunger. Aid agencies and governments should support countries struggling with hunger by providing humanitarian assistance in emergencies. At the same time, strong partnerships must be built through economic, technical, and political cooperation for long-term solutions. Nutrition and health. Nutrition and health care are crucial in the fight against hunger. The fight against hunger must ensure that children and mothers receive adequate nutrition and medical care. Improving health services can help prevent the spread of diseases, especially infectious diseases. Education and awareness. It is important to raise awareness about hunger among the population and provide educational opportunities. This supports people to create solutions in their communities by providing education on agriculture, nutrition, and sustainability. Community engagement. The active participation of local communities is crucial in the fight against hunger. Community leaders, governments, and civil society organizations must work together to identify needs and develop effective solutions. Fighting hunger is a complex and protracted process. However, it requires determination, international solidarity, and a focus on long-term sustainable solutions.